Our next question is, does the coronavirus make you more vulnerable for long-term brain effects?
Well, certainly every medical question now is being looked at through the lens of the coronavirus right now, and not surprising. So we are learning things every day, but I can tell you what we know to date. A couple of things. One, people who are severely ill and end up in, for example, the ICU or in the hospital setting that needed to get a lot of workups and a lot of blood tests, and oftentimes that included checking the spinal fluid. They are not seeing the virus directly in the spinal fluid. That has been relatively rare. However, the body's response to this virus, which is a really multiple system inflammatory response that happens, and this is what's causing all the problems, that probably does have effect on the brain. And it causes, this is a big word, but it causes a condition that's almost like an encephalopathy, which is like an inflammation of the brain itself. So it may not be the direct cause of the virus, but it may be the inflammatory effects that it does cause. So what we're seeing so far is that when somebody has that encephalopathy, there may be loss of memory, there may be impaired concentration, there may be confusion, there may be what doctors and nurses sometimes call delirium, and a delirium is like a clouding of your thinking and that sort of thing. Now, a lot of that may be just related to the acute event that's going on. Here's what we don't know. We don't know really long-term what kind of impact that will be. We do know from other pandemics, particularly in the last 20 years or so, you know, there have been the SARS pandemic, MERS, M-E-R-S, where they have been able to follow people. And in the same way, that post-inflammatory impact on the brain did cause some longer-term, months, years, of maybe not feeling like your concentration is quite as good, maybe you easily get confused, etc. Now, the one other category I should talk about, in addition to just the direct medical things we're talking about, we really have a hard time saying just how much more from a psychiatric point of view COVID is going to be playing on people. We do know that just folks from fear and isolation are having rampant amount of mental health issues, depression, anxiety, underlying mental health issues are coming out. And I suspect that we will see waves of impact of COVID over the next months and years, still of people just dealing with all this, maybe from the economy, from economic personal things, from a family member, from other impacts that may have affected them. So you add all that in addition to potentially the direct effects of the virus or indirect of the virus. I think we are just going to be learning day after day on the potential impact of this.
Mm-hmm.